I'm Megan. I'm a diabetes educator at UnityPoint Health. A diabetes diagnosis requires education so that you have a longer, healthier life with fewer complications. The goal of this video is to give you the information you need to live well with diabetes. It is also meant to complement the booklet given to you by your nurse, Diabetes and You. Your nurses and dietitians are available to give you the information and tools you need to live well with diabetes. Learning to take care of your diabetes will take time and may affect how you learn new things. But remember, we look forward to being part of your healthcare team and are available to review information with you as often as you would like. Please feel free to ask questions during the learning process.
Taking care of your diabetes. At discharge, your healthcare provider may refer you to a diabetes specialist if you are experiencing difficulties controlling your blood sugar, such as readings that are too high or too low, or for any other special needs related to your diabetes. We are here to help you manage your condition and offer services at several locations. What is diabetes? Diabetes happens when your body is not able to use and store blood sugar like it should. Sugar builds up in your blood, which increases your blood sugar. You may also hear blood sugar referred to by the clinical term of blood glucose. As you learn to care for your diabetes, you will gain more experience in how to keep your blood sugar at a healthy level. The role of sugar, glucose. Most of the food we eat is turned into glucose, or sugar, for our bodies to use as energy. Glucose is carried to the cells through the blood. Insulin is a hormone produced by the pancreas. Insulin is the assistant that helps move glucose from the blood into the tissues and use it for fuel and energy. Type 1 diabetes. Formerly called juvenile diabetes or insulin-dependent diabetes, type 1 diabetes is an autoimmune disorder most often seen in children and young adults. With type 1 diabetes, very little or no insulin is made in the pancreas. Because of this, the condition must be treated with insulin injections several times a day. It's important to check and record your blood sugars. Eating healthy meals and being active are important in managing type 1 diabetes. Type 2 diabetes. Formerly called adult onset or non-insulin dependent diabetes, type 2 diabetes can be caused by insulin deficiency or insulin resistance. Insulin deficiency is when your body does not make enough insulin. Insulin resistance is when the insulin your body makes does not work very well. Risk factors for type 2 diabetes include a family history of the condition, inactivity, 40 years or older, overweight, gestational diabetes. In addition, you may be at an increased risk if you have elevated blood pressure, high LDL cholesterol, or low HDL cholesterol. Living well with type 2 diabetes. Type 2 diabetes develops over time and is caused by the body's inability to control glucose in the blood. It may begin with insulin resistance, where the insulin your body makes does not work well. The condition can also cause insulin deficiency, where your body cannot make enough insulin. Living well with type 2 diabetes involves checking and recording your blood sugar, planning and eating healthy meals, and being active. It's also important to take any diabetes medications as directed by your provider. Some people with type 2 diabetes may need to take insulin. A healthy lifestyle, exercise, and diabetes medication may not be enough to alone treat your diabetes. Checking your blood sugar, goals, and supplies. Your healthcare team will provide information about checking blood sugar, including what blood sugar goal is safe for you and how many times to check your blood sugar each day. Checking your blood sugar will tell you if you need to change your food choices and amounts, activity, or diabetes medications. Blood sugar goals and supplies. The American Diabetes Association, ADA, provides guidelines for healthy blood sugar. You should always check your blood sugar as instructed by your healthcare team using your blood sugar meter. Blood sugar before eating or drinking should be 90 to 130 milligrams per deciliter. Blood sugar 2 hours after the start of a meal should be less than 180 milligrams per deciliter. The supplies you need include blood sugar test strips, lancets, and a blood sugar meter. All of these items may be purchased at most drugstores. Your insurance will cover all or part of these costs if you have a prescription. A1C lab test. The A1C blood test provides an approximate average of your blood sugar during the past 3 months. It actually measures the sugar coating your red blood cells. This lab test is used to identify complications associated with diabetes. A low A1C result has a low risk of complications, while a high A1C result has a high risk of complications. It's important to have an A1C blood test every 3 months. A1C is measured in percent, and a normal A1C is about 4 to 6%. The higher your blood sugar has been in the past few months, the higher your A1C will be. Your A1C goal is to be less than 7%, or what your doctor recommends. Hyperglycemia, or high blood sugar. Hyperglycemia is high blood sugar. Causes can include not enough diabetes medication, not enough exercise, eating too much food, stress, or illness. Signs and symptoms may include feeling thirsty, urinating a lot, feeling tired, sores that don't heal, unplanned weight loss, or vision changes. If you experience hyperglycemia, check your blood sugar more often and drink more carbohydrate-free fluids, such as water or tea. Be sure to follow your meal plan and work with your healthcare team to adjust medicine as necessary. People with type 1 diabetes should check their ketones if told to do so, and then drink 8 to 10 ounces of water and recheck your blood sugar in 30 minutes. Hypoglycemia, or low blood sugar. The opposite of hyperglycemia is low blood sugar, or hypoglycemia. This condition develops if your blood sugar is less than 70 milligrams per deciliter. If you experience symptoms such as blurred vision or dizziness, sit down and check your blood sugar. Eat one carbohydrate choice, 15 grams, and wait 15 minutes and check your blood sugar again. Carbohydrate choices include 4 glucose tablets, 1/2 cup of fruit juice or 1/2 cup of regular soda, or 1 cup of milk. If your blood sugar is less than 70 milligrams per deciliter, eat another carbohydrate and wait another 15 minutes. Check your blood sugar again. If it's still less than 70 milligrams per deciliter, call your doctor or go to the emergency room. You should not drive. Sick days. Sick days can happen. It helps to have a plan ready before you get sick so you know what to do. A cold, the flu, or other infection may raise your blood sugar. Talk to your healthcare team about getting the flu and pneumonia shots. If you do get sick, here's what you need to remember to help keep your diabetes under control. Check your blood sugar before meals and at bedtime. Drink 4 to 8 ounces of sugar-free, caffeine-free fluids like broth, tea, coffee, water, and diet soda every hour. Get plenty of rest. Follow your meal plan. If you cannot eat, drink fluids that will give carbohydrates, such as juice, regular soda, or regular Jell-O. Always take your long-acting insulin, even if you cannot eat. Check your ketones if you have type 1 diabetes. Call your doctor if you do not get better. If any of the following conditions persist, it's time for you to call your doctor. Have a blood sugar of 240 milligrams per deciliter or higher for 24 hours. Throw up or have loose stools for 6 hours. Have a fever that stays over 101 degrees. Have trouble breathing. Confusion. Have stomach or chest pain. Notice a change in your eyesight or you can't see very well. Are not getting better after 2 days. Meal planning and healthy eating. With a diabetes diagnosis, it's important to eat a balanced diet with healthy foods from all food groups. MyPlate.gov is a guide to help you know how much to eat from each food group. You can start being healthier by eating 3 meals a day. You should space meals 4 to 6 hours apart. Be sure to include a small snack if meals are more than 6 hours apart. Do not drink high-sugar soda and juices. Try to drink sugar-free Crystal Light, diet soda, and water. You'll need to limit milk to no more than 8 ounces or 1 cup at a meal. You may sweeten foods like coffee, tea, or cereal with Splenda or Equal. Eating right is important. A dietitian will visit with you during your hospitalization to review meal planning and answer any questions you may have. During follow-up care for your diabetes, you will also learn more about healthy eating. Diabetes affects many parts of your body. It's important to have regular checkups with your healthcare team. Refer to your Diabetes and You handbook for recommendations. Exercise and activity. Exercise helps your body use insulin better, lower blood sugar, cholesterol, blood pressure, and reduce stress. Be prepared to treat low blood sugar if you are active. Carry a fast-acting carbohydrate such as glucose tablets, take 4, if you are at risk for low blood sugar. Medications. There are many different diabetes medications that work in different ways. Your doctor will help determine your treatment. Use a reminder system to help you remember to take your medication at the correct times. Some examples include using a pill organizer, calendar, or checklist. You should always take your medication as prescribed. Do not change your dose or skip medication without talking to your doctor. You may or may not need medicine if you have type 2 diabetes. Blood sugar checks will help your doctor decide the best medicines for you.
Insulin is a key medication in controlling diabetes. Long-acting insulin, such as Lantus or Levemir, works up to 24 hours to prevent high blood sugars between meals. Short-acting insulin, such as Humalog or Novolog, is taken at mealtime, works quickly, and lasts for a few hours. Hi Marie, I'm Megan.
Hi Megan.
Very nice to meet you. I'm a diabetes nurse, and we're going to talk about taking insulin shots today.
Okay.
The first step to taking insulin shots is making sure you have clean hands, so we're going to go ahead and wash our hands.
Okay. And just doing this is good enough, right?
Yes, it's perfect. There are 2 ways that you can give your insulin shot. One is using an insulin vial, and the other is using an insulin pen. So I'm going to show you how to do both.
Okay.
With an insulin vial or a pen, either one, if the insulin inside is a cloudy insulin, you want to make sure to mix it before you use it. So you can roll the vial or the pen between the palms of your hands.
Okay.
And that'll mix that insulin up before you take it.
Okay.
So let's start with using the insulin vial. You want to clean off the top of the vial. If it's a new vial, it'll come with a little cap on top that you'll pop off. So you'll clean the top with an alcohol swab.
Okay.
And then you'll go ahead and prepare your needle. So there's going to be a couple caps. You're going to pull off the bottom cap and the top cap.
Mm-hmm.
And then what we do is we put in air into your syringe. So for this example, your doctor prescribed you 10 units of insulin. So we're going to pull back the syringe and the plunger on that syringe until there's 10 units of air in the syringe. Once you have the air in your syringe, you're going to stick the needle in the top of the vial and push in that air.
Okay.
Before you take out your needle, you're going to flip that vial over, and you're going to make sure that there's insulin covering the top of your needle in that vial.
Mm-hmm.
And now we're going to go ahead and pull back insulin into your syringe. So we usually say pull back, push up, and then pull back a second time. And that kind of gets any air bubbles out of that syringe.
Okay.
So you want to make sure that you pull back to the 10 units, which is your dose. Everybody's dose is different, but pull back to the dose that your doctor prescribed you.
Mm-hmm.
And always double check, because sometimes those little lines are very hard to see. Double check that you have the 10 units, so I'll have you double check and make sure that that's what we have. Okay, and then you can pull out your needle. At this point, if you're relosing the insulin vial and syringe, you'll be ready to give your shot. Now we'll talk about preparing an insulin shot. First, wash your hands with soap and water or an antiseptic. If the insulin is cloudy, mix by rolling the vial between the palms of your hands. If it is a new vial, pull off the flat colored cap. Do not remove the rubber stopper or metal ring at the top of the insulin vial. Clean the rubber stopper with an alcohol swab. Take the cap off the top of your syringe and needle. Pull the plunger back to fill the syringe with air. Pull back to the tip of the plunger until the tip of the plunger is at the line for the number of units of insulin needed. For this example, we'll pull the plunger back to 10 units. Push the needle through the rubber stopper of insulin at the top of the insulin vial. Push in your air. Without removing your needle, turn your vial upside down and pull back on your plunger. Your syringe will fill with insulin. Push that insulin back up and pull down to the dose that you have been prescribed to by your physician. For this example, we're pulling back to 10 units. It's always a good idea to double check your dose and double check the amount of insulin that you have pulled back in your syringe. Double check that there are no air bubbles between the top of the plunger and the top of your syringe. If you see air bubbles, push your insulin back into the vial and again pull back down to the dose. When you have the right amount of insulin without air bubbles, go ahead and pull out your needle. At this point, you're ready to give your insulin shot. But let's go over the pen. So the same kind of thought process with the pen. You're going to take the cap off and you're going to clean the rubber stopper at the top of the pen. This is your pen needle. You're going to take this tab off. And your needle's in there. You're going to stick it into the rubber stopper and you're going to roll it righty-tighty.
Okay.
Once you have that, take your caps off of your needle and you're going to prime your pen. So what we do is we look in this dosing window and we roll this to 2 and we're going to push and hold the bottom of your pen button and you're going to be looking at the top of your pen and that needle to make sure there's insulin bubbles coming out. If you don't see any bubbles coming out, then you need to dry it again. So it automatically rolls back to 0 when you're pushing and holding that button. You're going to roll it up to 2, push and hold, and look for insulin coming out of the top of your needle.
Okay.
That's just to make sure that there's no air between the top of your vial and the top of your pen and the top of your needle so that you get your full dose. Once you've done that, double check that you're back to 0 and then roll it up to the dose that your doctor prescribed you. Okay. So for this example, it would be 10 units. Okay? And then you'd be ready to give your shot.
Okay.
Insulin pens are another great medication option for insulin. To use an insulin pen, wash your hands first with soap and water or an antiseptic. Remove the pen cap. Wipe the rubber stopper with an alcohol swab. Okay. Remove the paper tab from the needle and screw onto the pen. Again, if you are using a cloudy insulin, you need to mix the insulin before you use it. You can roll the pen between your palms of your hands or rotate it back and forth about 10 times. Once you have your pen needle on, you can remove the caps. Pen needles need to be primed before each use. To prime your pen needle, look in your dosing window and roll your dose up to 2. You should hear clicks when you turn your dial. Once you have your dose rolled up to 2, push and hold the bottom of the insulin pen and look at the top of the needle for insulin bubbles. If you do not see any insulin bubbles coming out of the top of your needle, try it again. Look in your dosing window, roll to 2, and push and hold the button at the bottom. This is to make sure all the air is out of your needle and that your needle is working fine. Your dosing window should automatically roll back to 0. At that point, you would roll up your dosing window to the amount of insulin prescribed to you by your doctor. So for this example, our doctor prescribed 10 units. At that point, you would be ready to give your insulin shot. Okay, so let's talk about where you can give your shots and how to give an insulin shot. So you can use any part of your belly as long as you stay 2 inches away from your belly button or any scars.
Okay.
You can also use the thighs, so the top and the outer part of your thighs, or the back of your arms. Most people choose their belly. The biggest thing is to rotate around and not give the shot in the same exact spot every time. So if you take a shot over here, then you want to move it down at least 1 inch or 2 inches away from the last spot you gave your shot to give your next one.
Okay.
So the first thing you'd want to do with your skin is to prepare your skin with an alcohol swab.
Okay.
So where do you think you'll give your shot today?
Probably my belly.
Okay. Perfect. And then it's important to let that alcohol dry because it'll sting if you go ahead and give your shot without letting it dry. If you're giving an injection with the pen or with the syringe, either one, you're going to do the exact same thing. So you're going to go ahead and you're going to take that needle and you're going to go straight in at a 90-degree angle.
Okay.
You don't have to. Perfect. And go ahead and press down on your plunger. Make sure that needle's all the way in there. Press down on your plunger.
So I should press down.
Perfect. And then you want to hold that needle in there and count to 10. And then you can go ahead and pull out your needle. That gives you some time for that insulin to absorb before you pull out your needle.
Okay.
Okay? The same thing with an insulin pen. You would go ahead and clean your site, or it's a part of your skin, stick it in at a straight 90-degree angle, push and hold down on your pen. It'll automatically roll to 0. At that point, you would count to 10 and then pull out your pen.
Okay.
Now I saw that you were pinching, and that's perfect. With the longer needles, you would need to pinch your skin up. They say pinch an inch, so pinch up that skin.
Okay.
If it's a shorter needle like this one, so anything below 1.5 inches or 8 millimeters, you don't have to pinch anymore. So you can go ahead and just clean your skin, insert the needle, inject the insulin, count to 10, and then pull out.
Okay.
Okay?
All
Do you have any questions?
No. I think it's pretty clear.
Okay. It's important after you prepare your insulin shot to either cover the needle or lay your needle and syringe on a flat surface, so that way that needle doesn't come into contact with anything before you give your shot. It is important to get rid of your needles or your sharps in a designated container. You can either purchase a sharps container at your pharmacy, or use a liquid laundry detergent container, a bleach container, or a fabric softener container that's a thick, hard plastic and has a screw-on lid. After using your pen needle, make sure to unscrew the cap and place it in one of those containers. You can also do that with your insulin syringes.
Diabetic ketoacidosis, or DKA. When there is little or no insulin to help your body use sugar, your body will use fat as fuel. When the body uses fat for fuel, it produces ketones. Ketones build up in your blood and urine and make you very sick. This is called diabetic ketoacidosis, DKA. DKA is an emergency, and you will be hospitalized. It is most commonly caused by illness, infection, or skipping insulin. Checking for ketones. If you have type 1 diabetes, you are told to check for ketones. Ketones can make you very ill. You should check for ketones in your urine when your blood sugar is above 240 milligrams per deciliter, first thing in the morning. Your blood sugar is above 300 milligrams per deciliter at other times of the day. Any time you throw up, even once, you feel sick. The key to preventing DKA is finding ketones in small amounts. If this happens, give extra fast-acting insulin according to your doctor's instructions and drink lots of calorie-free liquids. Signs of DKA include trouble breathing, confusion, stomach pain, changes in vision, sweet, fruity-smelling breath, or extreme drowsiness.
Now we'll demonstrate how to check for ketones if you have type 1 diabetes. So Marie, I'm going to show you how to check for ketones.
Okay.
There are two different ways that you can buy keto strips or strips to test for ketones at the store. They either come in a canister or in a foil-lined package. If you buy the ones in the foil-lined package, they are good until the expiration date on that package. If you get keto sticks that are in a canister like this, once you open that canister, it's good for 6 months.
Okay.
Unopened, it's good until the expiration date. Okay. So you can do 2 ways. You can either urinate into a cup and put the keto stick into the cup, or you can urinate on the keto stick itself. Wait 15 seconds, and then compare the colors on your strip to the colors on the side of the container. And that will tell you how many ketones that you have in your urine.
How to care for your feet. Diabetes can cause high blood sugar levels, which can lead to foot problems. It's important to check your feet every day. Look for cuts, sores, red spots, swelling, and infected toenails. You may have foot problems, but feel no pain in your feet. If you have trouble bending over to see your feet, use a mirror to help you. You can also ask a family member or caregiver to help you. Have your healthcare provider look at your feet every office visit. To care for your feet, make sure to wash your feet every day in warm, not hot, water. Don't soak your feet, as this can dry out your skin and cause too much moisture between your toes. Before bathing or showering, test the water to make sure it is not too hot. You can use a thermometer, 90 to 95 degrees Fahrenheit is a safe temperature, or your elbow to test the water. Keep the skin soft and smooth. Rub a thin coat of moisturizing lotion and cream on the tops and bottoms of your feet. Do not put moisturizing lotion or cream between your toes because this might cause too much moisture and/or infection. Smooth corns and calluses. Thick patches of skin called corns or calluses can grow on your feet. If you have corns or calluses, check with your foot doctor about the best way to care for them. Do not cut corns or calluses. Do not use razor blades, corn plasterers, or liquid corn and callus removers. They can damage your skin and cause an infection. Trimming your toenails. Use nail clippers after you wash and dry your feet. Trim straight across and smooth corners with an emery board. Do not cut into the corners of the toenail. See a doctor when you can't see your feet, can't reach your feet, have toenails that are thick or yellowed, have nails that curve and grow into the skin.
While there is no cure for diabetes, you can control the symptoms and take charge of your health. Your healthcare team is here with you to give you the skills and tools you need to live well with diabetes. We encourage you to seek education after you leave the hospital for their diabetes care. Your nurse will help make this referral. Knowing how to keep your blood sugars in a healthy range is called diabetes self-management. That means most of the work in keeping your blood sugars and your diabetes in control is done by you. This can be overwhelming. Your nurses, doctors, dietitians, and other healthcare team members are available in the hospitals, in the clinics, and at home to help you.